Bowen, Director of Office of Oral Health and Department of Health.
And the question, thank you for coming.
Thank you.
The question is, for putting fluoride on your teeth directly versus drinking it, can you tell us the benefit of how much water you have to drink with fluoride in it versus actually getting the dental treatment?
Actually, this is kind of comparing apples and oranges.
Let's try for us, because that's all we have.
It's fluoride. The fluoride varnish that we talked about before has a very high concentration of fluoride ions that are in it. It is paint on to the teeth, and once saliva comes in contact, it hardens. And while it hardens, it stays on the teeth for up to 36 hours before as it slowly chips and wears away. But those fluoride ions are picked up in the oral cavity. The enamel takes that, and where the enamel may have had what's called a demineralized surface, where it's starting to slowly break down, that fluoride ion is taken up. It makes that part of the tooth a little stronger and more resistant to acids. Now, water fluoridation, even Dr. Smith has talked about how this benefits children. It benefits everybody throughout the life cycle. As senior adults, when we drink water, just the mere fact that you're drinking the water, those ions are washing around in the cavity and is being picked up again. If you're a senior adult, chances are you've had restorations. If you've had a lot of crown and bridge, this is just another way that fluoride ions are getting to the tooth, and it's helping to strengthen the tooth against recurrent decay. You'd like to know that your investment in all your expensive dental work is going to hold up. The fluoride is helping to do just that.
The question was the cost. We understand the process, but the question is the cost comparison. How much water do you have to drink with fluoride in it versus going to the dentist and getting treatments to get the same benefit? So we also look at cost versus how to get the same treatment, the same good health. How much water do you have to drink, and how much treatment on your directly to the teeth, and the difference in those costs.
I don't know that I could put a cost figure on that for you. I'd have to do like Dr. Smith said. I'd have to go find some research on that. I just know that as I'm telling you, the exposure of the fluoride ions are strengthening this. Now, when you're also comparing the non-fluoride...
But can you just tell me, does it take gallons of, does it take years of water to get the same if you went to the dentist? You can give us some comparison with our dentist.
Throughout the life cycle, as you're consuming beverages or food that is processed in areas where they already have fluoridated water, it's called a halo effect. You're still getting fluoride ions in the mouth. I can't put a dollar figure on that. I can't tell you how much you need to drink per day. I know that you will not go over what is a recommended level per day. It's very rare that somebody drinks the gallons that you're indicating for there to be any issue or problems.
Well, I'm just trying to get a cost figure of what it actually takes. I think there's got to be, you guys have to know something about that.
If you're asking about the cost of a fluoride varnish, how much does that cost an individual?
How much is the cost typically?
In our local health units, the fee for that is it's being reimbursed at $19.95.
Okay.
How often do you need that?
To have good dental health.
If you had no fluoride, we recommend that high-risk individuals have that applied every 3 months.
Okay. And so how much water costs to an individual with fluoride in it to get to the same equal treatment? How much water you got to drink with fluoride in it? If you were saying, hey, to get your good dental health, you got to drink 10 gallons or 2 gallons or 2 cups.
The cost of providing optimally fluoridated water to an individual for a lifetime would be less than $70.
And that would be how much liquid per day that the person would really need to drink to get that off. Now we're getting down to how much do you have to drink a day, and do the children drink it, or do the adults drink the amount?
Now, I think that obviously would vary from individual to individual. What I do know is that the cost for providing optimally fluoridated water to an individual for a lifetime is very low, and
But we don't know what optimal is, because you can't answer that question. You can't tell me how much I have to drink for my child to really get the benefit of that fluoride. So you can't tell me the cost to that average person, or that, you know, how much do they have to drink to get that optimization? So I guess, and then the other thing is, so I'm drinking all this liquid that's fluoridated. What if that doesn't go well with my body or my child's body?
There,
You can't say that you would know whether it does or doesn't, because a lot of people study this, and they're intelligent, they can read, they can study, they go for years. They can give me more about fluoride than I ever wanted to know.
we have over 70 years of experience with fluoridated water. Currently, over 2 million Americans and over 200 million Americans, over 2 million Arkansans are drinking fluoridated water. I don't have any case in which a medical doctor would tell an individual to avoid drinking fluoridated water at the 0.7 parts per million based on any recognized scientific evidence.
The packaging for fluoride, what is the danger warning on the fluoride package?
What are you talking
On the
about?
packaging for fluoride that goes in the water?
Certainly, if you get too high a concentration, there can be problems, but not at the 0.7 parts per million.
But you didn't answer. What does the warning say? What do the warnings on the package say?
I've got a water engineer here who could address that specifically.
All right, that'll be fine. But I thank you for your time and trying to answer those questions. Thank you very much.